In this section, we're going to review the normal sonographic appearance of the shoulder and the normal sequence that we want to take for our normal pictures. When approaching the shoulder, you should think of the shoulder as a complete exam, meaning that you're always going to take the series of sequences that we're going to show you. This is important in order to best appreciate the pathology that is going on in the shoulder. When you do other areas of the body, often you will do a much more focused exam. If you're doing a follow-up exam, you may just do a focused area of the shoulder. But again, initially, you want to focus on a complete exam. When approaching the patient for the shoulder, it makes best ergonomic sense from our experience to place the patient facing the opposite direction of you. So they will face away from the machine. I will typically face towards the machine, and this allows a comfortable ergonomic position both for my hand and for using my other hand to potentially work on the ultrasound machine. Now, this does not allow the patient to view the image, but you can go back and show it to them afterwards. The first image we want to take as the shoulder is the transverse bicep. As I come in, I have my patient with palm up in a neutral position of internal and external rotation, and I'm going to bring my probe in parallel to the floor and place it directly over the humerus. As I mentioned, this is the home position, and a position that I know I can find the anatomy very simply. As I'm approaching the patient to do the transverse bicep and going to that home position over top of the humerus, I want to think again about my probe orientation, and I'm going to take the fin, and again I'm going to place that, as we discussed in a previous section, to the left. This orientates the screen such that the left side of the screen is the left side of the patient as I'm viewing the patient. That way, if I do a long axis slide towards the left, we actually see the probe go towards the left on the screen, and vice versa. In this case, you can see that I now brought in the normal echogenicity of the tendon, and it appears brighter. If I apply just a little bit of superior tilt, you can see it becomes completely anechoic. Notice we have our deltoid muscle over the top. If we go more superior there to the skin, we can see the subcutaneous skin and subcu fascia. Very important to notice in this image is that the deltoid has a very thick septum in this particular patient. And I naturally had positioned the groove away from that septum. You can see if I do a little bit of a long axis slide to the right that the septum comes more directly over top of the bicipital groove. And in this case, because the septum is thicker, more fibrous tissue, it attenuates some of the signal, making less signal being able to penetrate deeper, resulting in a poor appearing bicipital tendon. So it's very important when you have a very thick deltoid tendon or mid-septum that you move that out of the way by slightly sliding your probe one way or the other. Now the ideal picture we want to take is to get that bicep tendon at the highest point of the tuberosities. Here you can see a lower point, and here we can get a little bit of a higher point, along with a nice bright transverse tendon. Now in our normal